Let me tell you about the gastrointestinal complaints of Veratrum album. The important thing I want you to remember about this remedy is everything happens in extremes. If there's vomiting, it is profuse. In diarrhea, it is frequent stools. Smallest movement brings on the vomiting or diarrhea. Then comes the exhaustion with cramps and cold sweat. Even in constipation, it is total inactivity of the rectum. Now, let me explain each of these. The Veratrum album patients suffer from excessive vomiting, lots of vomiting. Remember these two modalities. Whenever the patient drinks something, he vomits. When he moves from the bed, there is vomiting. Nausea and vomiting, both. The patient suffers from both. During this time, he has pain in the abdomen. And what's the feature of the pain? He feels his abdomen is cut with a knife. After so much vomiting, not being able to drink anything, and on top of that, the abdominal pain, the patient feels nothing but exhaustion. He feels very weak, even more so than ourselves. So that's about vomiting. In diarrhea, the patient has to pass frequent stools. Like I already told you, like excessive vomiting, frequent passage of stools. Moving even a little brings on stool. That pain I told you in vomiting, as if the abdomen is cut with a knife, the same pain is present here as well. Again, with frequent passage of stools, the patient is exhausted. Another feature to remember in veratrum is cramps. There is loss of fluid and loss of electrolytes. So naturally, the patient experiences cramps. Now, for the cramps, they begin in hands and feet and then spread all over. I told you about exhaustion, I told you about cramps. Also remember cold sweat. That's another related feature. You can prescribe this remedy for cholera, though cholera is not that common these days. Gastroenteritis. In both cholera and gastroenteritis, there is excessive vomiting and profuse diarrhea. In diarrhea from fright, you can think of veratrum. Also in gastritis with chronic vomiting, you can think of veratrum. In constipation, the patient has no desire for stool and the stools are painful. They're large, hard, and black. Especially in infants and children, they make them cry. If you found this video useful, save it and send it to a friend or share it in your stories. Let's try to build a community here and follow me for more such tips.